So you're a 46-year-old male and you're living a somewhat sedentary lifestyle, considering the fact that you work 12-hour shifts, sometimes 3 days consecutively. And then additionally, you have the back pain that I'm actually working on with you that we're trying to take care of during our treatment plan. And I understand that, you're tired. Sometimes some days you just may not be feeling like working out, which is understandable. And what you want to know is, you know, can omega 3s, help your blood pressure? So we've noted in the past that you actually do have high blood pressure when we actually took your blood pressure. And additionally, you told me that your parents, your mom and your dad, have hypertension and that they're on medications for that. So I specifically can't tell you, if you have hypertension or not. That's something that your primary care physician would actually have to do further testing for and actually diagnose you with it and give you the appropriate medications for that. However, what I can do is, answer your question about omega 3s and try to give you some other tips and tidbits about your daily activities and intake in your diet for what you can do to help lower your blood pressure in case you do have hypertension, or just simply to just lower your blood pressure, because I can definitely tell you that it's on the higher end of the blood pressure of what we want on the scale. So yes, omega 3s can help you with your blood pressure. They induce anti inflammatory effects. Now, anti inflammatory effects is essentially what the name implies. It makes it to where there's not as much inflammation going on. So, how these omega 3s work is similar to how you get into your house every day. You have a key ring and you have several keys on it, but only one key on that key ring is what's going to allow you to um, put the key in the hole, turn it, and allow you to actually open the door so that you may enter into your home. Well, omega 3s work essentially in a similar fashion. There are a lot of processes that goes on in regards to how they work, but this is just a simplified version of it. Simply, the omega 3s are what can be called, I guess, the key in regards to the earlier analogy that we used to put in the keyhole. Omega 3s are that, and they allow the actual gates to actually open so that more ions can flow through. So, with this being said, these ions are what allows vasodilation. Now, what vasodilation is Hoshi et al. In 2013 has done a study to actually explain these effects. And what vasodilation is simply the expansion or the distensibility of the actual vessel, the artery in this case, since we're talking about blood pressure. And when you have a wider vessel, that means that the the blood can actually flow through it more efficiently, pretty much like a water hose. The bigger the water hose is, the more water you're going to get out of it. So, with this being said, this is ideal and this is what we do want, because when you have high blood pressure, that means that there is more pressure that's on that vessel and it's not allowing the proper blood to flow accordingly, and it's having to apply more pressure in order to get that blood to go to the direction that it needs to go. Now, with that being said, omega 3s can assist with that, like I said, via vasodilation. But also, males are more likely to actually be hypertensive. Now, there's a study by Bakova et al. In 2013 that took rats. There was male rats and female rats, and they noticed that the male rats ended up having a certain molecule that promoted vasoconstriction. Now, what vasoconstriction is the opposite of vasodilation. It's constriction of the vessel, pretty much what the word means. So when you have a constricted vessel, you have a smaller hole that the blood can actually run through. So when you can't necessarily get blood through that hole, your body is going to put more pressure so that it can push that actual blood through that vessel, thus causing hypertension or high blood pressure, leading to hypertension. So, also was noted in regards to omega 3s and how they can help you. Um, it was a study done by Zen et al. In 2012, where they pretty much noted that the reason for high blood pressure or hypertension or other cardiovascular diseases is because there's a faulty wall. The walls of the vessels are faulty. Now, with that being said, that means that the proper nutrients aren't, being able to filtrate into the vessel, and the other nutrients are maybe potentially flowing through and causing different effects on those vessels. Now, with that being said, with that dysfunction on the actual wall of the vessel, that can create a whole boatload of problems. Hence why when they performed a study, they found effects that omega 3s do, just like the effects that I've explained earlier in regards to the earlier study by Hoshi et al. They actually promote the dilation of the actual vessels. However, they've noted that there could be some discrepancy in regards to if omega 3s actually work as significantly as the studies have shown to show. They have noted a study in the past that has been done that said that omega 3s doesn't necessarily have a significant effect on actual distensibility or dilation of the vessels. However, those subjects had other complications. They were type 2 diabetic and other things. They had a lot of other things going on with them upon some of those subjects, which could skew their results that they retrieved from it. So, that being said, I still think that omega 3s will be a good asset to your diet or supplementation to your diet. And there are different sources that you can get these from. You can get it from fish sources like anchovies or salmon, or you could actually take it in a vitamin form, where you can get it from maybe Walmart or Walgreens, any place that sells vitamins. You can go in and you can look for the omega 3s, get those fatty acids, and you can take those by mouth daily. Or if you're not necessarily eating the fish, if you're eating the fish as well, you could potentially not do it as daily, just whenever as needed, whenever you need the omega 3 fatty acids. So with that being said, I do recommend, like I said, that you do take omega 3 fatty acids, and that it could actually help. And if it doesn't help, I feel as though what's the harm in trying something that's not gonna be detrimental to your body, so that you could potentially reap the benefits in regards to lowering your blood pressure.